Because autism is a complex disorder, this training module will first review several models of autism, with an emphasis on the things that most impact employment. Following that, we will discuss a few other aspects of autism that are significant to providing accommodation and services to adults with autism. Note, this is not about diagnosing ASD, just helping vocational rehabilitation or VR supervisors train counselors to help people with ASD. Changes in diagnostic definitions and public awareness over the past few decades have contributed to a dramatic growth in the number of children identified as having an autism spectrum disorder, ASD. Approximately 1% of 8-year-old children are identified as having ASD. About 500,000 youth on the autism spectrum will age into adulthood over the next decade. Half of middle-aged adults, or those between 45 and 64 with ASD, had severe or profound intellectual disability, compared to less than a fifth of young adults or those between 18 to 24 with ASD. ASD is reported to occur in all racial, ethnic, and socioeconomic groups. ASD is about 4.5 times more common among boys than among girls. There are key signs to autism. The first is persistent social and communication challenges in multiple contexts. For example, individuals may not be able to start or acknowledge a conversation in a standard manner, or may not be able to hold a conversation, or avoid sharing of interests or emotions. Individuals with ASD may also have challenges following normative nonverbal communication, such as avoiding eye contact and not understanding or using gestures. Individuals with ASD may experience challenges with developing, maintaining, and understanding relationships. For example, an individual may have difficulty making changes or changing behavior in different contexts, and may have a lack of interest in peers. The second key sign is restricted or repetitive patterns of behavior or interests. For example, an individual may line up objects or repeat a phrase. An individual may also have a strong preference and adherence to routines, and thus may show distress at small changes. Another example is eating the same food or wearing the same clothes every day. Individuals with ASD may also focus on a specific interest, for example, focusing excessively on baseball. The third key sign is that individuals with ASD may also be very sensitive or insensitive. For example, they may be indifferent to pain or temperature, or another individual may be extremely sensitive to smells. Autism is identified at an early age, and as adults it impairs current activities, such as social skills and obtaining and maintaining a job. Autism is also not explained by another disability, such as an intellectual disability. However, individuals frequently have other disabilities, such as an intellectual disability or catatonia, the abnormal movements or behavior when someone is upset. In addition, for vocational rehabilitation purposes, it can be helpful to consider two issues that frequently emerge for individuals with ASD. Some individuals with ASD may have poor executive functioning or the ability to plan activities, and related to this, may be able to see the details but not the larger picture. Others have difficulty maintaining their attention or organizing their thoughts and actions. Executive functioning difficulties can also be associated with poor impulse control. Theory of mind refers to one's ability to perceive how others think and feel, and how that relates to oneself. This challenge often leads others to believe that the individual with ASD does not have empathy or understand the person, causing social problems. It is also the case that often individuals with ASD may not be aware that they lack this ability. Thus, When training VR counselors about individuals with ASD, and when discussing coaching needs for individuals with ASD, it may be helpful to take into consideration how individuals with ASD perceive others. While diagnosing autism is complex and important, at the end of the day, for VR counselors, it might be better to think about the level of impact autism has on an individual. Surprisingly, individuals with a level 1 can be the most challenging. In school, they were academically strong. They were most likely educated on grade level and received only accommodations. They typically took full course loads with little room for social skill intervention or vocational experience. After these individuals graduate high school, they are more likely to fail in college, as well as other post-secondary options, and be underemployed. Individuals with a level 2 may be underestimated in terms of their educational abilities. If still in school, they are typically enrolled at 1 or 2 grade levels below other students the same age, and receive modifications to their coursework. Despite having more flexibility in their course schedules, given low expectations others perceive, they are most at risk for being overlooked for enrollment in college or specialized training programs. Although individuals with a level 3 needs will need lifelong supports, they can be the easiest to place. Since they were most likely to be educated in a self-contained setting, they had the greater opportunity to receive more intense intervention. Many of these individuals will love simple, repetitive jobs. Based on the data from the National Core Indicators Project and the American Community Survey, research indicated that deficits in social communication skills have been responsible for almost 90% of employment loss for individuals with disabilities. Reports showed that workers with ASD have exhibited social communication difficulties with supervisors and coworkers, and this barrier has served as the primary hindrance to job performance. Realizing the importance of social communication skills to help adults with ASD acquire positive employment outcomes, there is a need for evidence-based strategies to improve employment outcomes for this population. When talking with VR counselors about individuals with ASD, it may be helpful to focus on strengths of individuals with ASD rather than just their challenges. This is also a more person-centered approach and may help to identify types of jobs that would work well for someone with ASD. It is also important to consider potential struggles. Again, not all of these apply, but it may be worth a VR counselor to check in and assess if their client struggles with any of these. Now that we have discussed what it means to have autism spectrum disorder, we will now move into improving social communication skills for individuals with ASD. First, our goal is to present research-based information to identify how VR counselors can better support the social and communication skills of adults with ASD as it relates to employment. To do that, we examined literature and products, such as research-based trainings, to identify how to improve employment outcomes. We reviewed articles primarily published in the U.S., but also included a few other countries focusing on communication and social skills for individuals with autism. Ultimately, we examined 210 articles and products, and of that, 29 were included in our literature review. After looking at the literature and other products, 4 themes emerged: interviewing skills to obtain a job, social skills used on the job, self-advocacy and making decisions for yourself, and compensatory strategies to remind oneself about activities. Not surprisingly, practicing, using role play and mock interviews with explicit instruction social skills such as small talk, attitude, and lessons on how to open and close improved performance at least for mock interviews. One high-tech study using virtual reality job interview training improved interviewee performance during live standardized role plays. Modeling interview skills was shown in 2 studies to enhance ratings by interviewers, and in one to increase rates of obtaining internships. When we talk about on-the-job social skills, they are often behaviors that we don't think about. Saying hello to and holding conversations with colleagues, for example, or understanding when someone is having a bad day and showing empathy. Alternatively, if someone keeps looking at their watch, knowing that you need to keep the conversation short and move on. For individuals with autism, on-the-job social skills can be challenging. For example, some people with ASD are nonverbal or may not always talk. They may have difficulties in simple conversations. They may repeat phrases or words, also called echolalia. Finally, some people with ASD may have inappropriate body language, such as turning away, standing too close, or too far away. As an aside, these are challenges for neurotypical adults when interacting with individuals with ASD. Some of these challenges, such as repeating words or phrases, are actually supportive of learning language. What supports on-the-job social skills? The first key activity that supports on-the-job social skills is group meetings that are similar to counseling support groups. In these types of interventions, the foci and the outcomes typically related to social and vocational skills, problem solving, interpersonal relationships, coping strategies, and communication skills. In these types of activities, group members learn by practicing, learning from each other by sharing personal experiences and listening to others by giving advice. In one study by Brock, almost 2/3 of participants had a paid or unpaid internship after the program. One of the case studies will provide more guidance regarding this style of developing social skills. For example, faded coaching, where job coaching is slowly faded out, and using a covert audio device, in other words, an earpiece for the client and a phone or walkie-talkie for the coach, allowed the coach to provide coaching without being too close. It supported workers engaging in tasks on time and increased social interactions. Other studies focused on supported employment, which includes support obtaining and maintaining a job. These generally assisted participants obtaining a job and improving social and communication skills. In this context, self-advocacy refers to the ability to advocate for reasonable employment accommodations on behalf of oneself. Self-advocacy training is often part of a larger program for teaching social skills communication. In Skill 2, we noted that job coaching supported on-the-job social skills. Job coaching is also helpful in training individuals to advocate for themselves. Effective practices of job coaches included role-playing, modeling, corrective feedback, direct instruction, and instructing on learning strategies. The 2 intervention studies found associations between job coaching and increased awareness of self-advocacy once the job coach had faded away or individualized sessions had ended. In one of the studies, job coaches provided guidance through the use of technology, where the job coach provided instruction through an earpiece. Again, this resulted in improved social and communication skills. In fact, a systematic review on the effects of adult employment assistance services found that tailored job coaching was one of the most important supports for success in employment for adults with autism. In one study, group training sessions focused on planning, creative problem solving, and identifying quality services, and led to increased self-determination, but only in the short term. Compensatory strategies are anything that supports learning or completion of a particular task without prompting or assistance by others. Examples of strategies include training, reminders, checklists, and technological assistance. These memory aids are not just for performing activities and planning, but can also be for improving communication. Not surprisingly, standard memory aids such as checklists, using an iPad, or other technology improves one's ability to complete tasks. Thus, for example, in one study, an employee was given audio support and picture schedules to support the employee to learn to match identical product logos, in this case 2 cans of Pepsi, so that the employee could assist in refilling the soda vending machine. He then learned to match the logos to a specific product as a way of requesting the correct type of soda. Technology has definitely supported employees in reminding them to communicate. For example, in one study, an iPod Touch was successfully used to support employment independence through the use of visual cues facilitating social interaction. Similarly, in another study, iPads were used to improve social communication skills and support employment independence in a separate study. With the help of iPad video prompts, one of the participants learned how to structure her day and how to interact appropriately with coworkers.